from the station that's on your side. This is Channel 7 News Daybreak.
Welcome back into Channel 7 Daybreak. Today is Wellness Wednesday, and Dr. Devon Ballard joins us this morning. And he's from Baptist Health, and he's going to be talking a little bit about the flu and how flu numbers have been lower this season, at least so far, Dr. Ballard. We know we're not out of flu season yet, but just juxtaposing that with the COVID numbers and what's happening right now, we've got some viewers who have been asking why the flu numbers have been a little bit lower, and I'm glad you could shed some light on that this morning. Good morning to you.
Morning. Thank you. So there's probably it's multifactorial. Number one, I think there's been a significant increase in people getting the flu vaccine. Number two, everybody's been wearing these things for the last, 6 to 8 months. But those are two big parts. The big part, I think, is causing a significant decrease in flu that we've seen, not just here, but nationwide, is the congregation of people. Okay, so people aren't getting together for birthday parties, Thanksgiving, Christmas. The kids are not out of school and meeting all together. People aren't traveling. So another major kind of vector of flu is if it's not in Arkansas, it usually goes west to east. So usually California towards Arkansas. But if they're not in Arkansas, but they flew to California to go to Disneyland, and it was kind of rampant in California, and they flew back here, you have these pockets of flu that will outbreak because of travel. Well, people aren't traveling. I think I heard that travel on cruise ships is down 90% in the last 8 months. Travel in the airports is probably down 30 to 50%. So just in general, the travel and congregation of people is a significant factor. Also, people are more diligent about washing their hands, not as much direct contact with people, hugging, kissing, etc. So that's why I have not seen one case of flu yet this year. My partner had one 3 or 4 months ago. It was just a sporadic case. But talking to our lab, we haven't seen it a lot in kids here. We have 9 providers. We haven't seen a lot of adults here at all. So it is significantly milder. We'll knock on wood on that where it continues like that. But that's kind of my 2 cents, I guess.
Well, we talked months ago, and before flu season even started, and you referenced how this is something that was, kind of on y'all's radar in terms of expecting lower numbers based on other countries that you kind of use as a kind of a preview of what we could see, correct?
Correct. Yeah, it started even Australia. When it first started, the flu numbers were down significantly versus the normal, and it kind of started there before it came here. So it was to be expected, but expecting something and proving something are different. So it's kind of it's come to prove that it is a lot less than expected, which is good because with COVID, you don't want to have flu also because that could kind of double whammy right there on a lot of people with respiratory or illness wise. So.
All right. Well, thank you again for sharing that with us this morning, Dr. Ballard. We appreciate your time. And as always, you can contact Baptist Health with the information on your screen. Call the Baptist Health Helpline at any time. And Happy New Year to you. And we'll talk with you next time, Dr. Ballard. Take care.
Thanks, Chris.